Welcome back to Learning Anatomy with Dr. Bakari. And if you are visiting my channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the similarities and also the differences between the ulna and also the radius. This is where we have the ulna here on this side, and on this other side is where we have the radius. These two bones are bony configuration of the forearm region. We'll be highlighting the similarities and also the differences between these two bones. So starting first with the similarities, we say that these two bones are the bony configurations or landmark of the forearm region. Now let's try and highlight the similarities that exist between these two bones. Both bones are long bones. So in terms of structural classification, the ulna and the radius will be classified as a long type of bone. And long bones are generally seen to have two ends, and in between the two ends, we have the shaft or the body. So for the ulna, this is one of the ends, and this end is the proximal end because it is located at the upper region. Also on the radius, we have the proximal end, which is also highlighted here in white. Then if you go more inferiorly, we have the distal end that is highlighted here in black for the ulna, and also the distal end here of the radius. And in between the two ends, we have the shaft. Now this is where we have the shaft here, harrowed at the central part. These two bones, of course, we already highlighted that they are located in the forearm region. These are the bony background of the forearm region. And these two bones are also seen to be lying parallel to each other. So they are seen to be placed side by side to each other within the forearm region, and they are seen to also articulate with each other. This means that the ulna and the radius will be articulating, of course, at this upper end, and this is what is referred to as the proximal radii-ulnar joint. While at the distal region, we also have a connection or articulation that they create with each other, and this is referred to as a distal radii-ulnar joint. So at the proximal end and also at the distal end, they are seen to be articulating with each other. They are also seen to be connected also along the shaft region, and this is specifically along their interosseous borders. Don't forget that in our previous lecture on the radius and also on the ulna, we highlighted the interosseous borders. We say that it is through these borders that the interosseous membrane will be connecting these two bones together. It is also important that we highlight the fact that both ulna and radius are seen to articulate with the humerus, although they are seen to be articulating with specific regions of the humerus. Now let's try to illustrate this. This is the image here of the inferior region or lower region of the humerus. And of course, the ulna, specifically at the trochlear notch, will be articulating with the trochlea of the humerus. While on this other side, we have the capitulum. The capitulum will also be creating articulation points with the head of the radius. So you see that there are specific regions around the inferior region of the humerus that the ulna and the radius will be connected to. It is important that we highlight that both of these bones are connected to the humerus, even though they are connected at specific regions. Also at the inferior region, they are also seen to be connected to the carpal bones. These two bones are also seen to help provide structural support for the forearm region. They are also seen to exhibit the same pattern of movement against each other, which of course is pronation and also supination. They are also seen to have styloid processes. This is where we have the styloid process. The styloid process for the ulna is located medially. And of course, on the radius, this is where we have the styloid process, which of course is located laterally. The two bones are also seen to have nutrient foramina. Nutrient foramina are holes created around the shaft region, which of course provides blood supply to the bone tissue itself. So these two bones are seen to have foramina along the shaft region. For the ulna, it is specifically seen to be located on the anterior medial surface of the mid-shaft region. While for the radius, it is located around the anterior surface of the middle third of the radius. The shaft of the two bones are also seen to have three borders and also three surfaces. We've tried to highlight this in details in our previous lecture on the ulna and also on the radius. If you've not checked out those lectures, please kindly go and do so to keep yourself updated. They are also seen to undergo the same type of bone ossification, which is basically endochondral ossification. We know that endochondral ossification is a bone that is produced from an initially formed cartilaginous model. Now let's go to the differences, and we'll be putting the differences in a tabular form. So for the first one, the ulna is seen to be longer than the radius, which means that the radius will be shorter than the ulna. And this is basically attributed to the processes created around the proximal region. In the anterior proximal part of the ulna, we have the coronoid process, while in the posterior part of the ulna, we have the olecranon process. These processes are actually extensions, and these extensions, of course, help to create a longer length around the proximal region. And this is why it is seen to be longer than the radius. From the length, the ulna is positioned around the medial side of the forearm, while the radius is positioned around the lateral side or region of the forearm. The head of the ulna is also distally placed. This is where we have the head of the ulna around this lower region, and the head of the radius is proximally directed. And this is why you have the head of the radius, facing the upper part. The upper end of the ulna is also larger than the upper end of the radius. And this is basically attributed also to the processes created around the proximal region of the ulna. And this is what is carved out here around this part. So you see that in the anterior part, we have an extension that is referred to as the coronoid process. Posteriorly, we also have another extension that is referred to as the olecranon process. It is these processes that, of course, create this enlargement or expansion around the proximal region of the ulna. Then if you drive to the radius on this other side, you see that the proximal end is smaller and it is disc-shaped. And this is what is shown here in this image. When in the lower region for the ulna, it is smaller. This is where we have the lower region of the ulna. You see that it is smaller and also narrower. And of course, it will be contributing to the minor part or region of the wrist joint. While if you go to the radius, the lower part is larger and also broader. And this is where it contributes to the major part of the wrist joint. So the wrist joint is majorly formed by the radius. And this is basically due to the expansion that it has around its lower region. And this is why it is able to accommodate the carpal bones. We also already described this in details in our previous lecture on the radius. Also going to the proximal region, the ulna around the proximal end, it has a trochlear notch. This trochlear notch is what receives the trochlea of the humerus. So proximally, it is seen to be creating an articulation with the trochlea of the humerus, while the radius is seen to be creating an articulation with the capitulum. We also described this in our previous slide when we try to highlight the similarities. So the differences here is that even though both bones proximally connect to the humerus, they are seen to be connected to specific regions of the humerus. While the ulna will be connected to the trochlea, the radius will be connected to the capitulum. Also the styloid process. The styloid process of the ulna is seen to be smaller and also medially placed, while the styloid process of the radius is what is harrowed here, and it is seen to be larger and also laterally placed. Also talking about the interosseous border, we also described this in our previous slide. It is through these borders that these two bones will be connected, and this connection will be created or formed by the interosseous membrane. So the interosseous border is what is harrowed here in green, and it is seen to be directed laterally. For the ulna, it is going to be directed laterally because it is going to be connected to a bone that is positioned laterally. Don't forget that the ulna is positioned medially, while the radius is positioned laterally. While the interosseous border of the radius is directed medially, and this is because it will be connecting to the ulna, and because the ulna is directed or positioned medially, the interosseous border of the radius, of course, needs to be directed medially. And I hope this is understandable. And this is basically because the ulna is positioned in the medial side of the forearm, and the radius is positioned in the lateral part of the forearm. So we should expect also that the interosseous border through which the connections will be created will also be directed accordingly. Thanks for watching this video. I hope you find this useful. Bye.